Set 30 table listings and figures technical question and answers. Answers are highlighted in green. Question 1. Which of the following is the most appropriate table to summarize adverse events by system organ class and preferred term for a safety analysis? Now option A says demographics table. Now we are not talking about the demographics table. It is the question related to adverse events. Option B says subject disposition. Now question is related to adverse events, not related to subject disposition. So this is not the right answer. Again, option D says exposure summary table. Now here we are talking about the adverse events, not about the exposure. So this is not the right answer. So the answer itself is in the question is the adverse event summary table. So the correct answer is C. Now this table groups adverse events by system organ class and preferred term to evaluate safety. Question 2. What key population should be considered when generating the primary efficacy endpoint table? Now option A says all enrolled population. No. Option C says per protocol violations only. No. Option D says screened subjects only. Now, you cannot do the efficacy analysis table, for the screened subjects. So this is not the right answer. So the correct answer is ITT, intent to treat population. Now this population reflects the real world effectiveness by including all randomized subjects. Hence this population is used to generate the primary efficacy endpoint table. Question 3. What is the purpose of a listing in clinical trial outputs? To provide graphical trends. Now we are talking about listing and not about graphs. So this is not the right answer. Option B says to show aggregated summary table. Now the question is related to listing and not related to summary. So this is not the right answer. Option D says to highlight only statistical results. Now results can be presented in a specific table or a graph, right? So the question is related to the listing and not related to any results. So this is not the right answer. So the correct answer is to present patient level data in detail. So the correct answer is C. Listings provide raw or derived data for individual subjects to enable detailed review. Question 4. In a time to event Kaplan-Meier plot, what does the y-axis typically represent? Now the correct answer is survival probability, which is answer is C. Now here the cumulative hazard is not the right answer. Number of subjects enrolled is not related to the y-axis. The number of events is also not related to the y-axis. Now the y-axis represents your survival probability, which is y, and the x-axis represents related to the time, like say in months, years, or weeks or days. So this specific y-axis typically represents the survival probability as to what are the chances of that specific oncology or a cancer patient to survive. So that is highlighted in your Kaplan-Meier plot. So the y-axis represents the estimated survival probability over time for each group. Question 5. What technique is commonly used to present a change from baseline over time for a continuous lab parameter? Now option A says bar chart. Now bar chart is related to stacked kind of a chart. So this is not the right answer. Box plot is generally used to generate your outliers, or those points which are not fitting into the data. So that is used to generally identify how many outliers are there in the specific data. So this is not the right answer. The question is related to change from baseline, right, which is not related to shift table. So this is not the right answer. So the correct answer is D, line plot with error bars. So this change from baseline over time is used for presenting the continuous lab parameter. So the correct answer is D. Now line plots show mean or median change over time with variability represented by error bars. Question 6. In which scenario is a shift table more appropriately used? Option A says comparing demographic data. Now we are using the shift table in the question. So this is not the right answer. Option A. Option B says visualizing survival rates. Now the question is related to the shift table and not related to their survival. Option D says summarizing adverse events. Now the question is related to shift table and not related to adverse events. So this is not the right answer. So the correct answer is C, analyzing laboratory normal to abnormal shifts. So in this scenario, the shift table is more appropriately used. So it is used to help track changes in lab results from baseline to post-baseline status. That is what the shift table helps. Question 7. When should a by-visit summary table be used? Option A, to track subject enrollment across countries. No. To show cumulative adverse events. No. Option D says to present endpoint values only at baseline. No. So the correct answer is B, to summarize vital signs trends over each visit. So the correct answer is B. By visit tables capture parameters like blood pressure or pulse across different study visits. Question 8. Why is control terminology important in table listings and figures outputs? Option A, to hide sensitivity data. Well, in clinical trials, you cannot ignore, delete, or manipulate, or you can hide kind of sensitive data. So this is not the right answer. To simplify programming logic. No. Option D says to create more visual appeal. No. Visual appeal is not related to something kind of control terminology. So the correct answer is C, to ensure consistent interpretation of data. That is why we used CT. So the control terminology, for example, MEDRA, WHODD, drug dictionary, ensures standardized reporting across outputs. Question 9. What is the most common statistical summary shown in an efficacy table with continuous data? Option A says median only. No. Frequency counts, which is percentage and number. Now here we are talking about the statistical summary and not about counts and percentages. So this is not the right answer. Again, the question is related to statistical summary and not related to any statistical test or statistical parameters or interpretation values. So this is not the right answer. Option D, which is p value. So the correct answer is mean, standard deviation, median, min, and max. Now these descriptive statistics provide comprehensive insights into the data distribution, and which is generally used in common as a statistical summary, which is shown in the efficacy table with continuous data. Question 10. Which figure is ideal for displaying the distribution of a categorical endpoint? For example, response rate across treatment arms. Option A says waterfall plot. Now waterfall plot is generally used whether the shrinkage of a specific tumor has been reduced or not. So that is related to the oncology and the overall flow of the tumor size shrinkage. So this is not the right answer. Option B says histogram. Now histogram is also not the right answer. Now option D says line plot. Now line plot is also not the right answer. So the best fit for this figure is nothing but the stack bar chart, where you will see the treatments arm are presented in a stacked bar, especially the response rate values. So the correct answer is C. Now the stack bar charts display proportions of categories, for example, responders or non-responders clearly across groups. So say for example, I have a stack bar, right, in a specific chart. So what happens is, this is my treatment A that it represents, and this is my treatment B. So this is my stacked bar, right? So this is how it is being presented. Please like, share, and subscribe. Leave a feedback comment mentioning any topic that you want me to make a video. Looking forward for a positive response. Thanks for watching. Please like, share, and subscribe. Leave a feedback comment. Many thanks for your support and having great connection.